Okay, so this is the next one is reminders per preference. So what you have to, in this menu item, you're going to be able to send reminders to patients per their preference for preventative and follow-up care. So where did we already show an item where you can actually put in custom items so you can put in that what their preference is for how to receive this information? You guys? The other data tab. You can put an item in there in the other data tab saying patient's preference for reminders. And you can put paper for mail or electronic. So someone's listened. I'm glad. So this is the new change that we had to put into the system. So this is the batch communication feature. So basically, whenever you create a patient inquiry, you get a file called an INQ file. Makes sense. Inquiry, INQ, bravos. So when you have that INQ file, what you're going to be able to do is bring that into your batch communication, because that inquiry file is identifying which patients you have to send out that communication for. I don't have a screenshot of it, but basically what it is it's just saying what's your letter template that you want to send out to your patients, what you can browse to your inquiry file, bring that in, and then you can select how you want that to be distributed. So most of the time it's going to be per paper. So the statistic on this one is that more than 20% of, and this is, so I just want to stop you guys because this is where I almost got tomatoes thrown at me last time. So this is kind of weird, so just buckle your seatbelts here. More than 20% of all unique patients 65 years or older or 5 years old and younger. So the big thing that everybody said is, all right, you're going for 65 years old and older and 5 years and younger. That's not a misprint. That's exactly how it is off that statistic, and we've copied it in there and pasted it. So why it's that way is because who's paying you? It's Medicare and Medicaid, right? Medicare is 65 years old and older, right? So that's identifying that population. And then Medicaid is looking for their underprivileged youngsters. So that is why they put in that demographic. So that's not a misprint. That's really how it is on the items. And then this is actually what the rule states. So it's saying that those two populations are a little bit more at risk for certain things, and that's why they wanted to get them out there. So here's your denominator. It's basically all the patients that are in that age group of less than 5 years old or 5 years and greater than or equal to 65 years old. And then the numerator is number of patients in the denominator who were sent an appropriate reminder for whatever they need to be reminded about.